We've all heard stories about challenges consumers face when shopping for insurance coverage in the healthcare exchanges. To discover what consumers are experiencing firsthand, we went on the New York Healthcare Exchange and searched for basic information about health plans. The Partnership to Fight Chronic Disease, a coalition representing more than 100 different healthcare stakeholders, is focused on raising awareness of the human and economic toll of chronic disease and advocating for health reforms that lessen that burden. For all consumers, but particularly for people with chronic diseases, having good healthcare coverage is critically important. There are many questions consumers want to answer. Two basic ones are, can I keep my doctors, and are my medicines covered? To see what a consumer has to do to see if her doctors are covered, we went to the New York Healthcare Exchange, New York State of Health. We selected View Plans Now to Preview Plans. We narrowed the search to zip code 12143, Albany County, and said we were looking for medical care coverage. That resulted in more than 500 different medical health plan options, covering 62 pages. We'd narrowed the search to silver plans since those have been the most popular with consumers. That still left more than 150 different choices. We narrowed that search to just look at individual coverage and got 38 plan options from 8 different insurers. That's still a lot of choices for a consumer to evaluate. Although some state exchanges allow consumers to narrow their choices by searching across health plans for one or more doctors, this exchange does not have that option. That means a consumer has to check each of the plans individually. We tried silver plans from 2 of the insurers with the greatest number of enrollees to see what a consumer has to do to find a list of covered doctors. There wasn't a link to a list of covered providers up front. We selected the View Details button. That provided a list of 12 different options, but no obvious link to covered providers. By the terms used on the list, we're not sure if consumers would know where to look for information about doctors. We're not sure consumers would know that doctor's visits are considered outpatient services. Though there is a lot of information, including consumer costs for doctor's visits, there isn't a link to covered doctors. We tried several more on the list before finally locating a link to a provider directory under the last choice on the list, Plan Documents. The link took us to an external website. We had to select our state and then select a plan name or network from a list of 17 options. The first option, 2015 NYSOH Marketplace Plans, was tempting. We assumed that NYSOH stood for New York State of Health, the exchange name. But several other options include the terms via exchange in their names, including 2 silver HMO plan options, which closely match our plan's name. It's not clear to the consumer which to choose, and the fact that there are several options implies that the choice is important. We tried the Need Help link and had to answer a few questions. Following those questions, the result really didn't narrow our choices enough to know which network to choose. We selected one of the networks just to try the search engine and found the search engine relatively user-friendly. Figuring out which network to choose, however, presented several challenges. Ultimately, we weren't certain we were searching the correct network for the plan we were researching. We went back to the exchange to try our search with a silver plan from a different insurer. There isn't a link to search for providers up front, so we tried the View Details button. That gave us a list of 12 different options, with none providing an obvious link to a list of covered providers. We tried Outpatient Services, but there wasn't a link to a list of covered providers. We moved down the list and located a link to the provider directory under Plan Documents. Following that link, it took us to the insurer's website that has a search tool for covered doctors. We again had to select the name of our health plan, and this time had 6 different options to choose from. To make sure we had the correct one, we had to go back to the exchange to check our plan's name. We then went back to the search tool and selected Total Independence to make sure we were looking at the right network for the health plan we were researching. The search tool worked well, but it took some trial and error and several steps to find it. Overall, finding the links to search for doctors covered by health plans is challenging for consumers. There's no way to search across health plans to see which ones cover specific doctors, so a consumer has to check each plan individually. That's a lot of work given the large number of health plans offered. Each step presents a challenge to finding important information for consumers wanting to see if they can keep their doctors.